Brooklyn Independent Television.
As a child, were you constantly told to finish your milk because the calcium would make your bones strong? Americans' consumption of milk has fallen steadily for decades. Could be too much competition from soda and juice. There are other factors, of course, but too many of us, especially women, aren't getting enough calcium, and our bones aren't strong enough. Having weak bones, a condition called osteoporosis, can cause fractures, which can mean a major loss in quality of life. Healthbeat Sherry Carabin wanted to find out what preventive measures can be taken.
Most of us assume that our bones are strong enough to carry us wherever we're going. But how can we be sure? Recent statistics from the National Institutes of Health show more than 40 million people in the United States have or are at risk for osteoporosis due to low bone mass, raising their risk of breaking their bones.
Hi, my name is Georgia. I'll be doing your DEXA today, okay? What I need for you to do, you're gonna lay on your back.
One way to get a handle on the problem early on is by undergoing a bone density test or scan.
Now, I'm gonna get something for you to put your legs on top of.
A bone density scan is a procedure that we employ in radiology to measure the actual density of the bone itself. And we focus on the spine and the hip. And that gives us an indication of the susceptibility to a fracture, the potential risk for fracture. You see a T-score value is what we base it on. You also look at the Z-score.
In mid-March, 56-year-old Park Slope resident Daisy Ramirez had the test done for the first time at Brooklyn Heights Imaging on Atlantic Avenue.
I have pains, my legs all the time. My neck hurts me a lot. So the doctor sent me for a bone density.
Okay. And are you right or left-handed?
Right.
While osteoporosis can occur in both men and women at any age, it's most common in older women, especially those who are thin, have a small frame, are white or Asian.
People that are on steroids, people that have rheumatoid arthritis are at risk for the loss of bone mineral.
Other risks include having a family history of osteoporosis, as well as not getting enough exercise, smoking, and drinking excessive amounts of alcohol.
We don't see a large population of male patients getting bone density scans. It's approved every 2 years by Medicare for women. But there have been other studies done recently that show that there's not much of a change over a longer period of time, so it may not be necessary to do it as often.
Okay, I'm gonna start scanning you now.
The test is simple and painless and usually takes about 10 minutes to complete. The amount of radiation the patient is exposed to is much less than what's emitted during a chest X-ray.
I thought it was going to be worse, but it was okay. I thought they're going to use a needle or something on my bones. So I was scared, I was nervous, because I didn't know how it's going to be the test.
Turn this leg inwards. Okay.
Based on the results, a radiologist can determine if the patient's bone density is normal for someone that sex, age, weight, and racial ethnicity. The radiologist can also detect osteopenia and osteoporosis.
Osteopenia is a mild loss of bone density, and when it becomes more profound, then it's defined as osteoporosis. Osteoporosis, when that condition is diagnosed, the patient is much more prone to the potential of developing a fracture in the spine or elsewhere in the body.
If someone has a bone density scan and there is a problem, what can be done?
There are means to treat the patient and improve the bone mineral, the bone mass, with drugs or calcium supplements.
Lifestyle modifications are also important, like eating more dairy products, green vegetables, certain fish, and some fish oils, as well as doing weight-bearing exercises, quitting smoking, and cutting back on alcohol and cola products. Calcium supplements should include vitamin D, which helps the body absorb calcium and minerals. In cases where the patient does not yet have osteoporosis, these changes, along with supplements, may be enough. But one thing is certain, the earlier a problem is detected, the better.
Okay, there you go. Let me take this out of the way. I don't want you to hit your head.
That's why Daisy Ramirez didn't put off having her test done and plans to tackle whatever problems might be discovered right away.
All right, put your shoes on.
This is Sherry Carabin reporting for Healthbeat Brooklyn.
Watch this and other Brooklyn Independent Television episodes online at brickartsmedia.org/BIT.